All right, let's continue here. All right, so miscellaneous gastrointestinal drugs. You have your antiflatulents, such as simethicone, which break up GI gas bubbles, okay, causing gas or causing you to have flatus, farting, or burping, belching it out, okay. And then we have our antiemetics, or emetics, are used. Let's see if we can highlight it here. So are used mostly in emergency situations to produce vomiting by direct action on the vomiting center. Okay. And then you have disfluram, which is also another one. Okay, used in patients who are addicted to alcohol. And then you have your conadiol, which acts on the liver to break down radiolucent cholesterol gallstones. There we go. I'll highlight all that. Okay. So, first, antiflatulence action, like it says, breaks up and prevents mucus surrounded pockets of gas in the intestines. Gives gas bubbles, breaks them down, allows you to pass them out. Okay, and it even says charcoal is occasionally used as an antiflatulent as well. And uses says they're used to treat problems that produce bloating, flatulence, and postoperative gas pains. Is when these are most often used. Highlight that there. Okay. It says the patient will complain of being full, feeling bloated, distended. Okay, and that's usually when these are given. So you're going to determine if the flatulence is caused by food or whether changing in diet may decrease the symptoms. Okay, and it's often used together with antacid therapy as well. Your gallstone, okay, says they act on the liver. It says to suppress cholesterol and cholic acid synthesis, and also biliary cholesterol desaturation is enhanced, and breakup and dissolution of radiolucent gallstones will take place. Okay. Uses says it's useful in patients with gallstones that are kind of small. Their opacity will show through during an X-ray. And it says these patients are poor surgical risk because of the disease or advanced age. That's when you'll see these being used a lot. Adverse reactions. Okay. So you can see here it can cause diarrhea, anorexia, constipation, cramps, dyspepsia, gastric distress, and laboratory tests may be altered with these medications. Drug interactions. Okay. So biliary cholesterol secretions may be increased by estrogen, clofibrilate, oral contraceptives. They also counteract the effectiveness of gallstone solubilizing agents. Okay, and then aluminum based, like your antacids, may absorb bile acids and reduce the absorption of gallstone solubilizing agents as well. They should only be used in patients with previous hepatic problems, and careful monitoring of the patient's liver function is required. If diarrhea does develop, reducing the dosage, wrong one. See if we can highlight it right here. Okay, usually eliminates the symptoms if you reduce the dosages. All right, and then our digestive enzymes. Okay, we have pancreatic digestive enzymes. It says promote digestion by acting as a replacement therapy. It says they are made from pork pancreas, and healthy patients may find intestinal gas is decreased when they take the medications. Its use is for patients with poor digestion or pre-digestive purposes. And it says replacement therapy. It says may be used to relieve the symptoms of cystic fibrosis, cancer of the pancreas, or chronic inflammation as well. Adverse reactions: nausea, abdominal cramps, and diarrhea have been reported with these patients. Okay, and drug interactions, once again, antacids. It says may cancel out these medications. All right. So nursing implications, once again, patient history, find out belching, gassing, hiccuping, vomiting, constipation, pain radiating to the back, weakness, diarrhea, indigestion. Okay. Make sure that they're giving their digestive enzymes are being given with meals or snacks. Okay. Need to be swallowed whole and not chewed. It says monitor the patient for therapeutic effect in the absence of adverse reactions. Question the patient about the appearance of stools because it may help you evaluate the degree of malabsorption present. So patient and family teachings. Once again, capsules or tablets need to be swallowed whole and at mealtime, okay, or sprinkled on top of food if it's a powder. Okay, and it says the granules should always be taken with meals or snacks. And it says the patient must be careful not to breathe in the powder or touch it with his hands when opening. Direct exposure produces strong irritation. Okay, make sure that they're eating a well-balanced diet, fat, starch, proteins, maintain normal eating habits, and then the patient should report any discomfort. Okay, and then Disfluram. Disfluram, we already know, is a medication that's given for patients who are alcoholics to help them overcome their alcoholism. Causes them to have a lot of GI disturbances. Okay, includes severe nausea, vomiting, diarrhea. Let's see if we can highlight that. There we go. Okay, highlight that whole section right there. It says reaction is present until the alcohol is completely metabolized. And the intensity of the reaction is variable, but is usually related to the amount of alcohol swallowed, or amount of Disfluram and alcohol swallowed. Okay, make sure you read over this here. Disfluram reaction. Read this section here, guys. Okay. Uses, like we said, Antabuse, used for the management of alcoholism. All right. Adverse reactions can produce drowsiness, color perception issues, blindness, psychotic reactions. Serum liver enzymes may be elevated. Okay, hepatotoxicity. In the use, even with a small amount, you're going to get these negative reactions. Also, be careful when used with metronidazole and marijuana. It says has an addictive effect that may produce psychotic episodes. Exaggerated clinical effects of diazepam are produced when these drugs are taken at the same time as Disfluram. Nursing implications, patient teachings. It says should not be used if the patient has consumed alcohol in any form within the last 12 hours. And this includes the use of any kind of cough mixtures that may contain alcohol. It says do not use in the presence of severe myocardial disease. See if we can highlight this. Okay. It should be used in extreme caution in patients with these following conditions: diabetes, epilepsy, cerebral damage. Okay. All right, and then your complementary and alternative therapies. Highlight that and read over that, guys. And that should be it for your test. Read over all this information. Look at my highlighted notes. Study it. Highlight it in your book. And you guys will be ready to go for your test. All right, good luck, and we'll see y'all soon.